If you are over 75 and someone just congratulated you because your blood pressure is finally 120/80, do not assume that means you have reached the perfect number. Because for many seniors, the real question is not just how low your blood pressure is when you are sitting calmly in a chair. The real question is what happens when you stand up, walk to the bathroom at night, climb the stairs, or get out of bed too fast. And that is where the danger starts. The myth is not that blood pressure does not matter after 75. It absolutely does. High blood pressure can still drive strokes, heart failure, kidney disease, and disability. The myth is that one textbook number automatically fits every older adult. It does not. In fact, major experts now emphasize that blood pressure in older adults has to be individualized. Some healthy, carefully monitored seniors may benefit from lower targets, but very old adults, frail adults, dizzy adults, adults on multiple medications, and adults whose pressure crashes when they stand are a completely different story. And that distinction can determine whether treatment protects you or puts you at risk. Subscribe to Dr. Clara Hoffmann and leave a like right now, because this is exactly the kind of information families wish they had before a fall, before a fainting spell, before a kidney problem, and before a medication list quietly became too much. I'm Dr. Clara Hoffmann, and today I'm going to show you why 120/80 is not automatically the ideal blood pressure for every senior, what changes in the body after 75 that make blood pressure management more complicated, and the simple home-standing blood pressure test that can reveal a problem a routine office reading can completely miss. Let's start with the mistake that happens every day. An older patient goes in for a routine visit. She is 79. Her blood pressure in the office is 148/84. The number looks too high on the screen, so treatment gets intensified. One medication becomes 2. Maybe 2 become 3. At the next visit, the reading is 124/76. Everyone feels relieved. It looks like success, but then something else begins. She stands up from the sofa and pauses because the room feels slightly off. She gets out of bed at 2 a.m. and has to steady herself on the wall. She says she feels tired, a little foggy, not quite herself. Maybe she blames age. Maybe the family blames dehydration. Maybe nobody connects it to blood pressure at all. But the truth may be that the beautiful sitting number is hiding a dangerous standing drop. And for older adults, that matters. Because after 75, blood pressure stops being just a heart number. It becomes a brain perfusion number, a balance number, a kidney number, an independence number. Here's what changes with age. First, the arteries get stiffer. When you are younger, arteries expand and rebound smoothly with each heartbeat. That elasticity helps maintain stable blood flow. With age, arteries lose that flexibility. They become more rigid. So the number on the cuff does not mean exactly the same thing at 80 that it meant at 45. Older bodies often need enough pressure to keep blood moving effectively to the brain and other organs, especially when changing position. Second, the body's pressure sensors slow down. These are the reflexes that help you adapt when you go from lying down to sitting or sitting to standing. In a younger person, the body compensates fast. In an older person, that response may be slower or weaker. So even if the sitting blood pressure looks fine, the standing blood pressure may drop too far, too fast. Third, medications are handled differently. Kidneys age, drug clearance changes. The same dose that seems routine on paper can hit an older body harder than expected. That does not mean medications are bad. It means they have to be matched to the person, not just to the number. And this is where people get confused. Because yes, there are important studies showing that some adults 75 and older benefited from intensive blood pressure control. One major randomized trial found that carefully selected older adults did better with more intensive treatment than with a looser target. But there is a huge detail many people leave out. Those patients were selected, monitored closely, and they were not the full messy reality of every older adult seen in everyday practice. That trial did not mean every 78-year-old with dizziness, frailty, kidney issues, multiple medications, or unstable standing blood pressure should be pushed toward the same goal without question. That is exactly why current expert discussions emphasize individualization. In other words, the truth is more nuanced than the headline. For a strong, Active, carefully followed older adult. Lower may sometimes be appropriate. For a frail older adult who gets lightheaded when standing, has had falls, or is on multiple blood pressure medications, lower may be too low. That is the part too many people miss. And if you miss that part, you can end up treating the reading while harming the patient. Now, let me make this real. Imagine two people, both 82 years old, both with a systolic blood pressure around 150 in the office. The first person walks daily, has good cognition, stable kidneys, no dizziness, and no fall history. The second person has diabetes, mild kidney impairment, takes several medications, feels weak when standing, and already had one unexplained fall this year. Same age, similar office number, completely different clinical picture. Should they automatically be treated the same way? Of course not. That is why the idea that every senior should chase 120/80 is not medicine. It is oversimplification. Now, here is the part I want you to pay attention to very carefully. For many seniors, the most dangerous blood pressure number is not the one taken while seated in the clinic. It is the number nobody checks when you stand up. This is called orthostatic blood pressure testing, and it is one of the most overlooked pieces of blood pressure care in older adults. Here is how to do it at home. Lie down and rest quietly for 5 full minutes. Then measure your blood pressure while lying down and write it down. Now stand up carefully. Take one reading at about 1 minute after standing, then take another at about 3 minutes after standing. If the top number drops by 20 points or more, or the bottom number drops by 10 points or more, that is a significant warning sign. Especially if it comes with dizziness, dim vision, weakness, or unsteadiness. That can suggest orthostatic hypotension. And if you are taking blood pressure medication, that result needs a real conversation with your doctor. Not panic, not stopping your medication on your own, but a serious, specific conversation. Because the goal is not just a lower number. The goal is safe circulation to your brain, heart, and kidneys while you are actually living your life. This is also why symptoms matter. If you feel faint when you stand up, if your vision darkens for a moment, if you feel washed out, mentally foggy, or unusually tired after a medication adjustment, do not brush that off as just getting older. That could be your body telling you the target is too aggressive for you. And there is another important point no one should ignore. Very high blood pressure is still dangerous. I am not telling you to dismiss hypertension. I am not telling you to accept 180/100 and call it normal because you are older. That would also be wrong. The real message is this. After 75, blood pressure treatment is about balance. Too high raises stroke and heart risk. Too low, especially when standing, can raise dizziness, falls, injury risk, and medication complications. So what range makes sense? There is no single magic number for every person, but many experts now stress that in very old or frail adults, a systolic range around 130/140 may be reasonable if tolerated, instead of automatically chasing the lowest possible reading. Some adults over 80 may be managed differently from younger seniors. Frailty matters. Standing blood pressure matters. Kidney function matters. Symptoms matter. That is what real medicine looks like. Not a slogan, not a template. A personalized decision. So here is what I want you to do after this video. If you are over 70 and you take blood pressure medication, start keeping a home blood pressure log for the next 2 weeks. Measure at the same times each day. Morning and evening is a good start. Write down the readings. Then do the standing blood pressure test at least once, preferably more than once on different days if you have symptoms. Also write down how you actually feel. Dizzy, fine, weak, clear-headed, foggy, steady, unsteady. Then take that information to your next appointment and ask one direct question. Given my age, my medications, my symptoms, my kidney function, and what happens when I stand up, what blood pressure target is actually right for me? That question changes everything. Because now you are no longer treating a myth. You are treating the real person. If you are watching this for a parent, grandparent, spouse, patient, remember this. A senior can have a blood pressure that looks perfect on paper and still be under-perfused, over-medicated, unsafe when upright, and the consequences of missing that are not theoretical. One nighttime fall can change an entire life. One fainting episode can lead to a fracture. One overly aggressive medication adjustment can start a cascade of weakness, hospitalization, and loss of independence that never fully reverses. That is why this topic matters so much. Not because 120/80 is always wrong, but because calling it automatically perfect for every senior is wrong. That is the myth. And once you understand that, you stop chasing a textbook number and start asking a much smarter question. What blood pressure keeps this older adult protected, functioning, steady, and safe? That is the number that matters. I'm Dr. Clara Hoffmann. If this helped you, subscribe, like this video, and share it with someone over 70 or anyone caring for an older parent. And in the comments, tell me your age or the age of the person you are watching this for, because age, frailty symptoms, and standing blood pressure all change this conversation more than most people realize. And remember this, for seniors, the best blood pressure is not the number that looks most impressive on a chart. It is the number that protects the heart without starving the brain, protects the kidneys without stealing stability, and keeps you healthy not just sitting still in a clinic, but standing, walking, living, and staying independent.